Hello again. Cut myself off a few minutes ago. Wanted to just finish things up. Again, drug use changes how we see life, how we think about things. On a separate topic, can someone be addicted to a substance by only using it one time? Yes, especially with more addictive substances such as crack or meth. It is possible without fail. Although it's not normal, again, only 30% of individuals cross this fine line between addiction from misuse, abuse to addiction. So it's not a very large population. But I've met clients who have used one time or two times, and they were very quickly addicted to the substance, very quickly. I've also seen clients who were using substances for 15 years, who I was convinced they were not addicted. There was no way they were addicted. They still had chores, and for some reason, they were not. They didn't cross that invisible line. But this is a very individualized experience. Addiction is very individualized. No two people respond to addiction the same way, and it's an equal opportunity disease. I've seen twins who started using the drugs at the same time, at the same intensity for the same length of time. One fell into the classification of addiction, the other one did not. Again, addiction changes how we see the world. And one thing I would challenge folks to start thinking about too, most of us know someone who is addicted or is actively using drugs, and it kind of shades our perception sometimes in a good way or sometimes a bad way. And what we're trying to do is take a very large scale sociological view of addiction. What happens for most of the population, and what does addiction mean for most of the population most of the time? This doesn't mean that everybody responds the same way, because folks respond to addiction in different ways. I've never met two clients that were exactly the same, and I've worked with thousands of clients since 1994 who have used dozens of different types of drugs, individually or in combination. And family members. I've worked with 4 generations of family members at times who were actively using. And all of their experiences with drugs and addiction was quite different. So we may have only been exposed to 1 or 2 examples, or examples of drug use and addiction on TV, which is very, very dangerous. TV shows are notorious for giving really bad examples of what addiction is, especially those self-help shows. Even Dr. Phil provides a really bad example of addiction. Or those TV shows like Celebrity Rehab, or those shows like Intervention. That's not reality. That's made for TV. And that's actually victimizing the client, to be honest, who is on TV suffering from those addictions. So please, I ask folks to have an open mind and challenge yourselves. This doesn't mean you have to agree. It just means, how can this material challenge what you currently know and what you currently don't know? And how can this strengthen what you know or make you think deeper about the conversations we're trying to have? I hope we can have a deeper conversation about this material next Friday. If folks can join us, I would certainly. I think it will help without doubt. Take care.